Welcome viewers to another enlightening episode of Soul Talk Season 2, Embracing Holistic Wellbeing in the Digital Age. In today's discourse, we delve deep into the profound essence of community support, a theme that resonates with the very fabric of human connection and empowerment. In a world increasingly defined by digital connectivity, the significance of community support stands as a beacon of strength amidst the complexities of modern life. It's about fostering bonds, extending hands, and creating spaces where individuals thrive collectively. Today, we are privileged to have a lady grace our platform, bringing her wealth of experience and wisdom to illuminate the vital aspect of our existence. She is not just a name, she's a trailblazing visionary, an esteemed educationist, and impassioned social activist, a dynamic TEDx organizer, and a distinguished author and director of Vivekanand School. Ladies and gentlemen, in conversation with Mr. Kapil Gupta, founder and CEO of Solh Wellness, please welcome Ms. Megha Ahuja.
Thank you so much, Ms. Megha, for being here with us, and thank you so much for that lovely introduction. Let me jump into the questions right away, if you're ready.
Sure.
So, in today's digital age, where technology plays a significant role in shaping our lives, how do you promote and advocate for embracing holistic well-being, encompassing both physical as well as mental health?
As far as my work at school is concerned, at school we focus both on physical and mental health of the children. It's very important at this age. As far as the digital age is concerned, they become so addicted to all the gadgets, so it's difficult to convince them to leave that and go for a physical play in place of using the gadget. So we keep on doing a lot of campaigns for students as well as teachers. We have a health and safety council in our school. So, here everything is a student-run show. So we have different councils that take care of different agendas. So we have an environment council that focuses on all the environment-related issues. There's a health council that focuses on all the health-related issues. So we have very interesting challenges and all coming up for the children throughout the year, so that we can make them focus on their health. So there are very small little things, small little changes that we can do in our daily lives that can help, as simple as drinking water.
Sure.
So, or eating food. So we have a fruit break. We have a very interesting concept called DEAM, which is like drop everything and meditate.
Okay.
So 10 minutes, there are no teachers in the classrooms at that time. With a 10-minute break, like 11:30, when the bell rings, it is game time. You'll be surprised if you roam around in the school during that time. Each child has his eyes closed, and there's a devotional music going on in the PA systems, and they just go down and they just meditate.
Okay.
And these are the things that has helped a lot to channelize their energies into something positive. So we keep on coming up with such campaigns for the children to help them prioritize their health.
Sure. I guess technology must be something very interesting, because at some level, we all want students to be using less of technology and less of gadgets and everything. But at a different level, technology has become so pervasive that it's a must-have for them to use gadgets for educational purposes as well.
Educational, from our school's perspective, we are very, very strict on this thing, because at the time of COVID, we had no option. So that particular period has made children very addicted to their gadgets, because they had the reason to have them.
Sure.
So even parents could not say anything, because if the child is using, they can always say they're checking their homework. So post-COVID, first thing that we did is we told our parents that none of our homework is going through the mobile phones. There is nothing where they're required to use their phones for any communication from the school side.
Sure.
So that was the first thing we did, and because we kind of try that at least we make sure that they don't have any reason to go to technology for work. But of course, it is important. There are things like if they're doing any research, they have to go to internet and find things about it, which is fine. So it's all about using it in a positive manner. So that is where there's a very thin line there.
That's the balance.
Yeah, even if you talk about social media, it could be something good. It could inspire somebody by seeing like seeing the other people's achievement. But at the same time, somebody could go into depression seeing the other people's achievement, or other people are living a like this kind of life, or the kind of expenditure they are making. So there's a thin line. So you can. So it's all about how you use it, and it's all about educating the children to use it positively and for positive encouragement rather than
Sure. Great.
comparison.
And I love the being times that you talked about. Drop everything and meditate. That's wonderful. I'll use that somewhere. Now let's jump on the other side. So some of the initiatives that you have been a part of, like Udan, like Light Up a Life, showcase your dedication towards marginalized communities and how to empower them. Could you share a pivotal moment in your life from your journey that enforced your underlying belief within that, in kind of the potential of these initiatives?
I firmly believe that whatever we do, like if we can make a difference to even a single life through our initiative, it makes our own life worthwhile. So I don't think I do, like whatever I do a lot of social initiatives. Whether it is Light Up a Life is a very simple, like it's a very beautiful concept. We ask our students to find a dream of anybody who's lesser privileged than them, and then turn that dream into reality. It could be a very small dream, it could be a big dream as well. So like I'll give you an example. There was this child who was like who was from a lesser privileged background. He was like 7-8 years old, and we were talking to him, and he said his dream is to celebrate his birthday. So in his life, he's never celebrated his birthday. So my children got along. They like, kind of like arranged a birthday party for him, and that smile on his face. So that's what we mean by Light Up a Life. So I mean, then a lot of small, big things, and the kind of satisfaction you get by doing that is what keeps you going. So I think if anybody experienced that once, they'll never leave doing like bringing smiles to people. So that has been focus of my life. So Udan is again my initiative for special children. So we have a special school in the school only, which runs sports school.
Okay.
And we have been like they've been coming to me from last 5-6 years. There was a break in between because of COVID, because we could not do online with them because of the special school. And if somebody has been born with any particular ailment or disease or a mental condition, that doesn't make them a lesser human being.
Sure.
They are much more beautiful human beings than we are. So whenever I spend time with them, the kind of smiles that they spread, so you'll find them picking each other up. You'll find them helping each other. You'll find them doing things that amaze you. They've been a TED performance for me.
Sure.
So we have had those moments where they've got tears to us by excelling in whatever we do, and that's what and the kind of satisfaction because see for them I have always worked on things that would be solution centered. Okay, they cannot excel in academics, but there are other things that they could do. We try vocationally training them. We try whatever they make. We try to in our faiths and in our PTMs and all, we put up a stall, and whatever we raise out of it, we spend on them only. So that is how Udan has been happening. And whether it is dance, whether it is sports, they enjoy that. And if you can bring smiles to anybody, then why not?
Oh, absolutely. And I always say, empowerment is not necessarily coming up with the bigger initiatives that will impact everybody in the society, but also at the same time doing smaller initiatives that light up our life, as you rightly said. Great. So, and it's interesting that while you talked about ensuring that in the school there is no reason for students to use a gadget, but you come from a technology and management background yourself.
Yes.
How do you do that, the integration of that? So, in terms of the innovation and leadership that you bring to your role as the Director of Vivekanand School, how do you integrate that innovation, and how do you believe educational institutes can create a supportive environment that not only emphasizes students' mental wellness, but along with the academic excellence, of course?
So, talking about innovation and leadership, whatever I've done, like in all these almost 15-16 years in school, has always been innovation focused. So, here everything is a student-run show. There's a very different environment if you come and witness it. So, whatever events we do, they are student-centric and they are by the student for the student. So, we've done a Lit Fest last year. It was all the authors that they came, those who came here, they told us that it was better than even Jaipur Lit Fest. That's the kind of compliments we got post those festivals. And we've done things that usually happen probably at say IIM level or IIT level,
Sure.
so which are usually not happening in schools. So we were one of the very first schools to have our own TEDx. Now some other schools have followed, but we started it like 8 years back.
Sure.
So my focus has always been on giving that exposure to children. So our motto has always been deepening roots and broadening vision.
Sure.
So when we talk about deepening roots, it's very important to kind of get them connected to their culture and their values, which is with time, it's getting really difficult to do that. But yes, we do a lot of efforts when it comes to keeping them connected to their values and their culture. And parallelly, at the same time, when we talk about broadening vision, it's all about giving them these opportunities that are usually not happening in other schools.
Sure. Fantastic. And while you do all of this, I don't know where you get the time, but you are also the founder of Sashakt-The Ovarian Cancer Foundation. What mental health strategies have you observed to be effective for individuals that are navigating through ovarian cancer and actually cancer in general? And how can others learn from those experiences to better provide mental health support for those facing similar challenges?
So, Sashakt, first I'd like to tell you a little bit about Sashakt and how it came to being. My mother, she was suffering from ovarian cancer, and when she was diagnosed, I got to know that there are certain symptoms of ovarian cancer, and if they are observed early, it could be diagnosed early. So, for example, my mother used to complain of bloating for an entire year, and we never took it seriously. We always used to tell her, okay, take some antacid, you must have eaten something, that's why you're feeling bloated. And we never thought that it could be something as serious as cancer. After a year, when she was diagnosed, and first thing you do is like you research, right? So, when I found out that, okay, like it was clearly written that stomachache, bloating, frequent urination, all these are major symptoms of ovarian cancer. And I felt so guilty that despite being from the education background where we keep on attending so many workshops, so many webinars and other things, still I've never heard about anything about ovarian cancer. I thought I'd probably support, because there was already so much in my plate, so I thought I would probably support any organization that is working for ovarian cancer, so that okay, fine, I cannot change my own story, but if somebody's life could be saved by that awareness. Because I talk to hundreds of women and nobody knows anything about it. Sure. And we're not talking about rural women here. We're talking about all the educated urban women, and they had no idea about ovarian. So I thought I'd probably support some organization, and then I started finding out. And I found that in the entire country, there was not even a single organization that was working for ovarian cancer. It didn't let me sleep for days because it is not done. It is not done. There needs to be an awareness. And I had two options. Like I could have just cribbed about it that, okay, fine, there's no awareness, nobody's doing anything. Like, government is not doing anything. And the other thing is that whatever is in my hand, just go ahead and do something. And that's how Sashakt came into being, because I just listened to my heart and went about it. Because of course I cannot change my story, but if through Sashakt we can save some lives, then why not?
Sure.
And now coming to the second part of your question, where the mental health is concerned. The entire problem with cancer is that there's such a hue and cry created as soon as somebody is diagnosed with cancer, that the person believes that they are dying, which is not at all the case.
Sure.
As a society, it is the foremost requirement that we need to downplay cancer.
Sure.
If somebody has diabetes, we don't keep telling them, okay, you have diabetes, you have
diabetes. Right.
They just move on with their life and they do what is required to be done for them. They're taking injections, they're doing everything, but still their life doesn't stop. But with cancer, what we do is we ask that person to leave everything and they just become a cancer patient.
Sure.
Which is not at all required. The medical sciences have advanced. There are millions of survivors who are living fulfilling lives after successfully completing their cancer treatment. So it's very, very important. We just need to, some problem has come, we just need to find solutions and move on. So that acceptance. And first of all, as a society, we need to accept it. We don't need to label somebody as a cancer patient or a cancer survivor. They are individuals. Everybody have their own challenges. some challenges come into their life, which is cancer, they have to deal with it and they have to move on.
Sure.
This is how it needs to be addressed, which doesn't happen.
Sure.
Somebody who's diagnosed, their mental health obviously go for a toss because they think they're dying. So once somebody believes that they are dying, half the battle is lost anyway.
Sure.
Even the doctor's treatment. I know so many survivors and patients with the exact same diagnosis, but their outcomes are absolutely different only because of the way they dealt with it.
Yeah, yeah. And in a lot of cases, from the research I have done, in a lot of cases, most of the cancers, the doctors are looking at symptoms and determining that you may have cancer or you may have active, tumors that is spreading right now. Many times there is lesser information that is available, so we are just treating symptoms. In fact, one of the things I have been doing over the last couple of years, in some ways, is I have been doing a lot of conversations with healthcare institutes promoting this concept of providing mental health support, not just for the cancer patients, but essentially also for the caregivers of the cancer patient. What I have realized is, one, cancer is not an individual disease. And as you said, the belief is if somebody has cancer, drop everything and just be. You are no longer a person. You are now a cancer patient. And what that does for the most part is it doesn't just impact the patient; it impacts the entire
family.
And the approach towards caregiving, specifically how many times it is structured in India, becomes very challenging for people. So one of the things I have asked healthcare institutes, the question that I like asking them is, assuming I do something, let me not even say what will I do, okay? But I mean, I'm of course talking about implementing or providing capabilities, enablement through Solh Wellness. But assuming I do something and I'm able to improve the mental health of this patient and this caregiver a little bit, and over a 5 to 10 year life cycle, which is usually the life cycle of either the patient, getting cured or the patient, not getting cured. Usually it's a 5 to 10 year life cycle, depending on the kind of cancer that you have. Assuming within this 5 to 10 year life cycle, I can reduce their hospital visit by 1 or maybe 2. I'm not saying I can cure their cancer. I mean, it's a disease. They need to go through their oncologists. They need to go through their chemo, their radiation, their whatever surgeries, whatever else they need to do. But assuming I can give them enough support from a mental wellness perspective, both to the patient and the caregiver, and I can reduce their hospital visit by 1 or 2. Now, if I do that, number one, think about the kind of not just wellness, but essentially happiness that I have created for those patients. Number two, think about from a healthcare cost perspective, what kind of value has been generated for that patient. And number three, and probably most important, specifically in countries like ours, where there is a dearth of resources, think about how much healthcare has been opened up to be available for other people because these people have lesser requirement.
No, it's as far as my this thing goes, my experience with cancer survivors, even if you're not able to reduce their doctor's visit, even if you're, but you can definitely elongate their life.
Absolutely.
Because the ones who are dealing with the cancer with that positive attitude, I've seen people who've been told that, okay, you have just 5 months to go or 3 months to go. And it's been 5 years, 6 years, 7 years, and they're absolutely fine. Dealing with their chemos, but they're moving on.
Absolutely.
And it's all about the attitude of the patient. So it's as much as a mental game as it is a physical game.
It's a physical game. Yeah. And in a lot of cases, specifically in diseases like cancer, people just give up.
And once you give up, once you believe you're dying, then no doctor in the world can save you.
Yep. So, in my experience, I've seen people.
We do something very beautiful. Like we have this concept called dream boards. So we give them to cancer patients and survivors in our events, which is about like keeping your dreams in front of your eyes. So it's not about, rather than focusing on cancer, rather than focus on the things you want to do, and you can still do. I did that with my mother as well, and it did wonders with her as well. So I know the things. So this is something that caregivers should do for themselves as well as patients. Like they should talk to the patient and find out what all they want to do in their life. And there are people, like I remember meeting this 60-year-old lady who started modeling after her cancer diagnosis. Because she always had this dream and she was not doing anything about that dream. But once she was diagnosed with cancer, she thought that no, now
I can give up everything and focus on this one thing.
And now she's modeling and she's doing proper. So there are many stories like this.
And one other thing that I think is very important to look at, specifically as we think about cancer, and specifically as we think about patients and caregivers, I very sincerely believe that the entire caregiver concept need to be altered a little bit. It needs to become responsibility of multiple people in a very structured manner. Versus, in some cases, we have one person who becomes the caregiver and kind of along with the patient.
It depends from family to family, like whatever they structure it. But then the caregiver again doesn't need to drop everything they are doing, which is very important. Because then what happens is that if we lose the patient, the caregiver's life also comes to a halt because they've left everything for say 2 years, 3 years, and everything they were doing was taking care of that patient and all that patient. When that patient is not there, they have nothing to do, and they feel that their life is also ended. So this is again that something happened to a lot of people. But I think that for the caregivers also, like if I talk about myself, I started Sashakt. My mother was going through a treatment and she was just been 6 months when she was diagnosed. So if you keep your focus right, then you can do both the things parallelly. Like, for you to be happy is again, to keep them happy, you have to be happy yourself.
Sure.
And you have to be living your dreams also. So leaving everything is, I think, the way I said, we need to downplay cancer.
Absolutely. So let me ask my next question. So how do societal views on grief impact the accessibility and the effectiveness of mental health resources? And what steps do you think society should take to enhance support systems for individuals that are coping with loss and bereavement?
Again, yes, it's always loss of a loved one. It's something that is not easy to go through. And there are certain steps you have to go through it. Starting from denial and then finally reaching to acceptance. There's a lot of things that you have to go through.
Sure.
And in our society, the problem is that people don't understand grief at all.
Sure.
What happens is like you feel okay, fine. There's a period of like 10 days, 12 days. Somebody you've lost, somebody okay, you have grief. Now they expect you to be out again and fine and going on. But grief is not something that comes just once. It will come in phases. It will come again and again,
Sure.
and it will come at the most unexpected times. When you're not because I've lost my mom, so I understand it very deeply, and people around you don't understand that. If you're crying for no reasons, they'll label you as that. Okay, well, she keeps crying only. So it's very important for everybody, like in the society, to create that awareness that what losing a loved one means and how you'll get out of it.
Sure.
So, as a person who've lost it, they have to kind of channelize their energies and they have to accept their feelings and their emotions as well. So, it's very important for people around to be supportive.
Sure.
And the whole concept of grief and the whole phases of it needs to be taught, I think, in the schools as well. As a program. Because everybody has to face it somewhere or the other.
At some point of your life.
Even I believe that even the diagnosis of cancer is also a kind of a grief only. Because for somebody, you are anticipating your own death. So it again comes with a denial. There are people who just get, like, they go to the doctor, they get to know their cancer. For 4 months, 5 months, 6 months, they're out of picture. And then after 6 months, they're coming back with like a disease that has gone haywire. Because what they believe, no, I have not. So denial is the first phase that happens. Is they'll probably go to some babas and they'll think, okay, it's not cancer, it's something else, and they'll go away by doing other things. When only things get out. These are the kind of things that happen as well. So grief, anyway, I think to deal with it, I think the education about it is very important.
Absolutely. So, any thoughts in terms of how other educational institutes can probably create better capabilities, not just from an academic perspective, but more importantly from a mental wellness perspective?
From the mental wellness perspective, it's very important. See, for an educational institute, first of all, understand that every child has their own capabilities. It's not necessary that every child will excel in academics.
Sure.
Somebody might be good in dance or anything else or anything in this world. So it's all the role of the educational institution is to find the good in children, not the bad in them.
Sure.
And not label them as something because it's a very sensitive age like we are dealing with as an education institution. So it's very important for the whole philosophy of the institute to understand that okay, the children are never good or bad.
Sure.
They are going through a certain age. They might have some bad things in them, like they might have inculcated some bad habits because of their atmosphere or an environment. But every child has something good in them. So it's very important to focus on those good things and encourage the children to kind of improve the good in them rather than just asking them to improve something that they're lacking in.
Sure. On that note, thank you so much for being part of the Soul Talks, for talking to us today, for giving us such insights and such knowledge. And I still don't understand where you get the time. You work on children with special needs. You are director of a school. You run initiatives like Udan. You run initiatives like Sashakt.
I just listen to my heart and I just go along with the flow. That's how it goes.
So I wish you the best of luck.
Thank you so much.
You are able to flourish more of these initiatives and actually flourish the initiatives that you already have.
Pleasure was all mine. Thank you so much. It was a pleasure.